We're going to talk about IBS and we're going to talk about gastritis, but could you define them both?
Right. Okay. So IBS, years ago, it was used as an umbrella term for almost any digestive issue a person had. But now it has its own diagnosis code, and we know that there's four different types. It's IBS, C, constipation, D, diarrhea. But the most common would be the mixed, and then there's one that's just we don't know what it's about. So yeah, it's basically gonna affect your lower GI tract, where gastritis is the opposite and affects your upper GI tract. IBS is all about the lower GI tract, and it's got so many multiple issues that can cause it. And stress is a big one. It's a really big one. I think besides from the hormonal fluctuations in menopause, I think that the stress that so many people, so many women are feeling in the menopausal years is another reason why we see so much of it. But basically, it's going to affect like what we call the gut brain axis and the vagus nerve, which is like the main highway between the brain and the gut. And that's actually why the gut is called the second brain. And so these movements along this sort of axis cause little nerves to be fired or not fired. And then the end result is this IBS-like symptom. That's one of the biggest factors that cause it. And then we have gut dysbiosis, which I see as the most common. That's the thing I see mostly in my practice, paired with anxiety.
What
And
is, oh, I'm sorry. I'm
no, go
sorry.
ahead.
I was just going to ask, what could you explain what you said gut
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 dysbiosis.
dysbiosis?
dysbiosis.
Yes.
So gut dysbiosis is the imbalance of good and bad bacteria in the intestinal tract. We naturally should have a balance of the good bacteria or commensal bacteria and the bad bacteria. And they live very symbiotically together, happy, happy, until something triggers the bad bacteria to overgrow. And that can be antibiotics. I mean, I lived with IBS for 10 years before I figured out how to fix it. And mine was basically caused by overuse of antibiotics in my teenage years. And that can just, I mean, aside from getting rid of the bad bacteria, it just like crushes your good bacteria. And you need that good bacteria for like the gazillion different jobs it does, but basically to keep your gut healthy. And when that balance is off, you're going to feel it. One of the things that you can work on is your vagal tone because stress is such a huge part of IBS. And that vagus nerve, as we said, goes from the brainstem all the way down to the large intestine. And you want to keep that in good shape so it could do its job. And so just simple things like deep breathing, that diaphragmatic breathing can make a big difference in the vagal tone and really help with IBS symptoms. Um, what else is there? Like even like mind body practices like yoga, meditation are very helpful. Cold exposure, like even just splashing cold water on your face. You don't have to you
I
don't
was
have
like
to do one
cold
of those cold
plunge.
plunges. By the way, never gonna happen. Even though I know that they're so great, that's where I draw the line.
I don't like to be cold,
No,
so
I can't even the thought of doing that is, but also even something as simple as laughter helps massage that whole area. And there are vagal massages you can do, and there's even like a medical device that helps. And also another probiotic called Lactobacillus rhamnosus is another probiotic besides the Flora store that you
where can people get these probiotics?
um
Any
online they can look them up. I mean, I have an online store, but I have them under different names. It'd be hard to find them. Just know, the names of them: Lactobacillus rhamnosus and the Saccharomyces boulardii. are the two. And then once you're, using those, and then you can move to a full spectrum probiotic that has like, a bunch of different strains. But I always, with that too, always start low. You don't want to shock your GI system with a whole bunch of bacteria at once.
Right. Going guardrail to guardrail. That's what my husband always says. Don't go guardrail to guardrail on me. And Colleen reminds me too, because I was like, I'm going to cut all this. Don't cut all this out. You
Then
don't
you
know
won't
which
know.
one's bothering you. Yeah.
It's like babies when you start feeding them to
Right.
see if there's an
Right.
allergy, one thing at a. What about gastritis? Like, because we were going to talk about that as
Okay.
well.
So I just to end the other one, and it's good for gastritis too. And just because what you just said, I'm glad you brought that up. You want to journal. That is one of the most important things that you can do. Everybody hates doing it, but it is the most successful way for you to find out what's working and what's not working, what foods are working for you, what combination of foods. I mean, I remember when I was going through it, I was, keeping a real good food journal, and I realized that I could have chicken and I could have sweet potatoes, but I could not have them together. Isn't that weird?
That's
That's very
wild.
But
Yeah.
my digestive system wasn't strong enough to handle like proteins, the digestion of proteins and carbohydrates at the same time. It was that weak. So
Wow.
I
Yeah.
know it gets really tricky.
Yeah.
It's
You,
really tricky.
I noticed things that in the past that I could handle, and now I can't handle. Like I could eat onions. I used to, I mean, not that I would eat an onion, but I could, onions on things.
Yeah.
Fine. Now I cannot eat a lot of onions. And is that something common that people develop something, a
Yeah. I
an
mean, it's
intolerance?
Yeah, I mean, they are a little rough on the GI tract. They're a part of a family called Allium family. And when I do food sensitivity testing, I commonly see that, most of that family on it. So, I just think it's one of those things that we just
Right. I just didn't know if my body said enough of this, never again, like you've
You've
had your
reached
quota
your
for your
fill.
life. Yeah.
and it's too bad because they're so,
I
flavorful. They're so
know.
good for us. So
Yeah.
gastritis, another common digestive condition, but this time affecting the upper GI tract. And it's inflammation. It often causes damage to the gut lining. This one you really have to catch early because where IBS, it's uncomfortable. It's really causes a lot of disruption in your life. But gastritis could be dangerous. It really can because it can be acute or chronic, it could be erosive or non-erosive. And it's diagnosed through an endoscopy, but it can lead to ulcers and it can lead to even gastric cancer. One of the main causes of gastritis is H. pylori. It's an infection that targets the stomach. And in my opinion, people don't get tested for this enough. I mean, if you've got acid reflux, if you're burping, if you've got that weird feeling here, if you feel full soon after eating, and even other stuff, skin issues, because your anything in the GI tract is going to show on your skin for the most part. Eczema, psoriasis, all of that stuff. Um, and it's really you have to test for these things and you have to really especially the H. pylori because again that's a real hard one and it's very common. I think it's 80% of the population have it to some degree. That's huge. That
Oh,
is huge. And it is passed on from person to person, just kind of scary.
oh,
Um,
so you mean like
Wow.
through
contagious?
saliva,
Oh my. Okay. Okay.
bodily fluids. And so you would feel like a burning pain. And sometimes my clients that have had like raging H. pylori have no symptoms. It's very bizarre, but most people have acid reflux. That's
Okay.
the main thing. And you can test this through blood. Your doctor will do a blood test for it. Your GI doctor could do a breath test for it. Um, and your GI doctor would also do what's called a stool antigen test. But honestly, the best test for this is a stool, like a PCR stool test, because that looks for this H. pylori at the smallest possible level. So it doesn't show up in a lot of these tests unless it's after a certain mark. And again, then you already have it. You've already got damage from it. But looking in this PCR, like DNA test, it's going to find it so tiny that, you probably don't even have symptoms yet.
Wow.
Oh.
Yeah.
What can
what
go ahead. I'm
treatment?
so
Yeah, I was just gonna
what
say,
can
what
somebody
treatment?
do about it?
The treatment, okay, it depends on how high your levels are and how many are what called virulence factors you have. So there's like, I don't know, 7 different virulence factors. And if you have, the dangerous ones, then you would opt for probably the antibiotic treatment. It's a quadruple therapy. There's some PPIs in there and like 3 different antibiotics. It's rush. It's harsh. It's really harsh on the digestive tract. Another reason why you might opt for this is that it takes it just depends, but for most people, 2 to 4 weeks to eradicate the H. pylori. You have to retest to make sure. And for natural antimicrobials, takes like 2 months. But it's not going to be anywhere near as harsh on the system. So it just depends, because it's a rough couple of weeks on that antibiotic therapy. And it doesn't always work. I've had clients where it didn't, they went through all of that and it came back. It didn't work.
Can they take the probiotics while they're doing that therapy? Can those type of patients do that?
You can. Yeah, you'd probably just take that that Floromyces, the Florastor, Saccharomyces boulardii, so it wouldn't interfere with it. And then there's also a whole H. pylori diet with specific foods, broccoli sprouts. I love broccoli sprouts because, as I said, 80% of people have H. pylori, but also broccoli sprouts help with breast cancer prevention. So it's like a double whammy there. And they're good.
I don't even know if I've seen broccoli sprouts. I
Yeah,
mean, I
but
know I've seen the other
yeah,
types of sprouts, but I'm not sure if I have.
you probably, find those in like mostly Whole Foods, health food stores, but they also come in capsules. There's
Okay.
also like broccoli sprout supplement form.
Okay. Okay.
But yeah, so yeah.
Yeah.
A
There's
big
so
Amazing.
much to take in right now.
I
Yeah.
know. And that's why this kind of conversation can be, because there's so many, as you're talking about it, there's so many other things
Right.
that, come into play here.
Right.
As far as a natural therapy, the like gold standard for H. pylori therapy is something called a mastic gum. It actually is a gum, but you don't take it in gum form. You take it in a supplement form. But that's been like the gold standard for forever. And that the broccoli sprouts, a couple of other antimicrobials that you rotate, but it works well. But you've always got to retest and make sure that H. pylori is eradicated and out of your system, because it's a little bugger that likes to hang on. But the main thing I want people to get out of this is that, if you've got any of those symptoms, make sure that you get tested for it. And if your test comes up negative and you still have those symptoms, maybe think about doing this, it's called the GI map test. You can find it online. I do it in my practice. And you can get all kinds of information online about it too. But that's the test that I see really identifying it more than other tests.